Each year in America, 12.7 million discover they have cancer, and 7.6 million die of it. 9.6% of women and men will be diagnosed with cancer throughout their life. This percentage tends to be one of the leading causes of death in America. The overall cancer death rate has declined since the 1990s. Some main facts one should be aware about cancer is that it is not one single disease. Instead, it is hundreds of different types of diseases, all classified under one name. Some types of cancer are attacked and treated if detected with enough time in advance. A couple of examples of this disease include skin cancer, lung cancer, breast cancer, brain cancer, prostate cancer, colon cancer, ovarian cancer, leukemia, and lymphoma. Furthermore, cancer is not a disease that is given to certain people. This disease can occur at any age or moment in a person's life. The cells that are infected with the disease are called malignant cells. These cells are especially unique because they divide much faster than they should. These rapidly dividing cells are usually what can cause the loss of hair in a person with cancer. Screening tests can be helpful towards treating and preventing cancer. In fact, screening tests are the most useful way to prevent cancer. Furthermore, this method is useful because it allows the patient to know about the disease ahead of time and can be treated quickly before it spreads and is untreatable.
The cell cycle is regulated in a multitude of ways. Most cells will divide until they come into contact with each other. Once they do, they usually stop dividing and growing. The remaining cells will begin dividing again until they once again make contact with other cells. This shows that controls on cell growth and division can be turned on and off. For example, when an injury occurs, cells at the edge of the injury are stimulated to divide rapidly. New cells form, starting the process of healing. When the healing process nears completion, the rate of cell division slows. Control on growth are restored and everything returns to normal. The larger a cell becomes, the more demand is placed in the DNA of the cell. Also, when it becomes bigger, the cell has more trouble moving enough nutrients and wastes across the cell membrane. If they don't respond to the signal to stop their growth, abnormal cells are made multiplying a lot faster than they should. The group is working on leukemia. We chose this topic because we believe it's a cancer that is not common, really unpredictable, and is a cancer that we would like to know more about.
There are fewer than 2,000 U.S. leukemia cases per year. In a patient with leukemia, many of the white blood cells produced in the bone marrow do not mature normally. Choosing a doctor to treat one's cancer can be quite difficult. A hematologist specializes in treating disorders in the blood. Hematologist-oncologist is a doctor who specializes in treating people with blood cancers. Blood cancers are uncommon diseases, so it can be to your advantage to be treated by a doctor specially trained to focus on treating patients with blood cancers. Some possible environmental or genetic causes of leukemia include genetic abnormalities play a role in the development of leukemia. Certain genetic disorders, such as Down syndrome, are associated with an increase of
symptoms for cancer vary widely, or they may not occur at all. Some patients have abnormal bumps, unexplained fevers, night sweats, or unintentional weight loss. Cancer is nearly always diagnosed by an expert who has looked at cell or tissue samples under a microscope. There are 4 stages of cancer, 1 being most curable and 4 being very hard to cure. Stage 1 and 2 are usually the ones easiest to cure. Stages 3 and 4 are much harder to cure. Therefore, it may lead to risky surgery and extensive hospitalization. Doctors use the TNM system to describe the stages of cancer. T stands for the size of the tumor, N for how much of the tumor there is, M is for how much of the disease has spread in one's body. The result of this system helps doctors decide what stage of the cancer the patient is undergoing.
Leukemia isn't just one type of cancer, but actually a category of multiple cancers that affect our blood cells. Leukemia mostly affects men because they are more likely to develop CML, CLL, and AML more than women. The risk of leukemia grows more and more as you age. It is more common in whites rather than African Americans, although the reason is not clear. By taking drugs to help with leukemia, you may be introduced to many side effects such as low blood cell counts, infection, kidney stones, etc. New chemo drugs are being developed every day. None of these drugs or therapy treatments are guaranteed to get rid of cancer, but they can help. No matter how bad your cancer is, you must always have hope and faith, because not all patients pass away. Although most do, willpower, prayers, and love can heal anything. Not all types of leukemia can be prevented, but avoiding high doses of radiation, exposure to benzene, smoking, or the use of tobacco can help.